Good afternoon, dear colleagues. My name is OLEKSANDRA KOZLOVSKA. I'm Ukraine country representative of MedGlobal, NGO, US-based NGO. And today I would like to speak a little bit about our projects in mental health for physicians also and for families of detained civilians and missing one. Our main goal of our organization is to provide medical services and to expand the capacity building and training. Our main activities is training for physicians. So we bring American volunteers to Ukraine to train Ukrainian doctors and also, as they say, to exchange their experience between American and Ukrainian doctors and nurses. But once we had a meeting with Parliamentary Commissioner for Human Rights Office, Ombudsman Office, and they told us, maybe you would like to do something regarding the mental health. And then we analyzed these figures that more than 70,000 people remain missing in Ukraine, and then children grow up in a world where trauma has become part of daily life. And really we realize that mental health recovery is now an essential element of national resilience. And so we decided to try our first mental health related project in Ukraine. So we named it The Power to Live, and we provide mental health retreats. And these retreats are focused for the families, mothers and children of detained civilians who are in captivity either in Russia or in the temporary occupied territories. And also these mental health retreats are focused for families who missed their loved ones, most of them their fathers and their husbands. So, what are our goals? Our goals are reduce chronic stress, fear and emotional exhaustion, rebuild psychological and social resilience, and restore family connections and daily routines. So, we discussed a lot with Ombudsman Office how this training should be designed. It's not training, it's like mental health retreats, how it should be designed, how it should look like. So we chose a holistic model combining. So we use art and body-oriented therapy, mindfulness and grounding techniques, psychoeducation and emotional support, and community and family-based healing. So what we use, it's 2 days training. All of this training we have in the very good location. It names Ukrainian village. It is something like ethno hotel, not far from Kiev, in the forest. So we combine different practices, and we also use nature as one of these that help also for this mental health retreat. We use breath therapy and we use culinary rituals. So these families, together, mother and children, they bake bread and cook traditional meals together. So this creates stability and warmth. Also, most of the people, they are from eastern part of Ukraine or southern part of Ukraine. We had a lot of people from Mariupol, from Zaporizhia region, from Donetsk region. Also some of them were from Kiev region, from Bucha and other previously occupied territories. And for them, it is really interested not only this psychological support, but also culture and traditions, Ukrainian traditions. Because a lot of that people, they don't know Ukrainian traditions, Ukrainian culture, because historically they are from eastern part of Ukraine, where not very popular popularization of Ukrainian tradition and Ukrainian culture. So that's why we make bread together, we make borscht together, and also we have some games, something like this, about Ukrainian traditions, Ukrainian culture, etc. Also, we use art therapy, we use body practices, group exercises that you can see on the pictures. We have separate program for children from 3 to 15 years, creative games, storytelling, movement, and also like the final that they do, they paint 2 pictures. One of the picture is that mothers paint and others that children do. And most of them, it's about peace in Ukraine, about peaceful life. It's what they show their dreams, what they would like after this, not after this training, but what they would like for our country and for their future. And of course, M&E is very important. So our psychologists, before the retreat and after, they propose to make a functional self-assessment, and you can see that participants shown a significant improvement in emotional and physical state after just 2 days of this retreat. And it was like we asked children what was your feeling after these 2 days, and this young man, he told that for the first time in 2 years he felt safe and alive, and it's only first time when he slept well. So for us it's really very important that we do that can help people a little bit in such difficult conditions. So also we see the family and community impact and strong emotional bonds within families and new shared traditions of baking, reflection and care, and every time when they, for example, bake bread after, they remember these feelings that they felt during these retreats and these emotions also. And of course, our goal is continued support, not only these 2 days training. So that's why every family receive baker's kit to continue this ritual of baking bread at home. Also, we have monthly online mindfulness sessions to sustain resilience together with our psychologists that work with families during the retreats, and ongoing peer support groups to stay connected and cared for. So we have WhatsApp chat with all the participants, not with all the participants, but every retreat has its own group, and they can discuss in this chat wherever they want and ask also psychologists for support or some private messaging with psychologists. It's also possible. And what are our plans for the future with mental health retreats? We plan to expand retreats across all the 24 regions in close cooperation with Ombudsman Office. They have their representative office, so we would like to expand this next year. We focus on families of the missing and captured, and also we received several requests from our government authorities to expand our trainings also for that people that are militaries that prisoners of war. Now we negotiated with the authorities, and also what is our long-term goal? It's build mentally strong, compassionate, and resilient communities. Also, I would like to say a few words about our other mental health support project. I see that our colleagues from previous presentation, Razum for You project, also provide mental health trainings for professionals. We do it for healthcare workers because we realize that a lot of doctors they feel burnout, professional burnout, and also that we need to support our doctors that they can provide medical aid and support to their patients. So that's why, together with National Healthcare University, we created this program. It was a common program of American psychologists and psychiatrists who worked with mental health trauma after the Iraq-Afghanistan war, and also Ukrainian psychiatrists and psychologists. We prepared Ukrainian trainings. In this project, we don't bring American trainers. We only had one pilot with American trainers. So we see that for this special project, it is easier to have Ukrainian trainers. And so when we measured the impact and evaluated, 100 of participants found this training useful and relevant, and we received a lot of requests for extended group practice and follow-up sessions. Also, we did it for staff of Ombudsman Office who worked with the families of prisoners of war and of the detained civilians, how to prevent burnout and how to communicate with such groups, with such families. Also in this project, what are our plans for the future? We would like to continue this training and to expand mental health support and training for Ukrainian healthcare professionals. Also, we work together with healthcare universities, with medical schools, to integrate mental health and self-care modules into national medical education in order to teach every young future doctor how to prevent burning out and how to help themselves mental health self-care. Together we help patients, families, and those who dedicate their lives to saving others. I would like to thank you for your attention, and we also, as previous speakers, are open for cooperation. So please, if you have any ideas, we will be glad to discuss it and to expand our cooperation. Thank you very much.